So for the people living with diabetes, the main piece of advice I would give them is that the world has advanced in diabetes care.
Yeah.
And these days, people with diabetes can live a near normal life.
Yeah.
I attended the International Diabetes, the IDF conference in Melbourne.
Yeah.
That was around 2015. And there was a team of cyclists who were among the top performers in the Tour de France.
Yeah.
And they are all
diabetic.
type 1 diabetes.
Wow.
The team was supported by a diabetes company called Novo Nordisk.
Oh, yes.
And they were among the top performers in the Tour de France.
Yeah, I've
So
followed them actually.
the technology, the knowledge is increasing, so the patients can live a near normal life if the fundamentals are catered for.
That's true.
So all they need to do is to get as much information as possible, take charge of their health, be positive. There will be times when they are down, but those will be, we look at them as moments. Most of the moments, they will be okay.
Yeah.
So that is what I'm encouraging for them to get activated.
Yeah.
I keep using that word, the activated autonomous patient who takes care of their health. That is the key message. The rest of the things are to do with the health system and what, but for the patient, they need to take charge of their illness, and they can be the best healthcare worker for themselves.
Indeed.
Yeah.
This book actually mentions that in your diabetes care team,
Yes.
you, the patient, are the team leader.
Yes.
You are actually the team leader. You're not there to listen to. You're there to inform the doctor. I have this problem. What should I do about it?
Yes.
You know,
Yeah.
help the doctor
And even
to
question
help
the
you.
doctor and say, oh, you've said this, but there's this issue. Yeah. So, so the thing I want to add is that even in the email that you sent me, there was I call it it's called an adjective.
Yeah.
Diabetic.
Yeah.
Actually, we in our research group, we are reducing the use of the word diabetic because it denotes that the person is
limited in some way.
Yeah, but that the whole person is diabetic.
Yeah.
The whole person is not diabetic. They have diabetes.
Yes.
As one of the many issues they have. They have many other good things,
That's true.
but they have diabetes. So we are looking, when diabetes patients are not having a crisis, when they are okay, we refer to it as a life condition and not a disease.
Yeah.
So we are migrating to call it a life condition. And indeed, even people without diabetes, they have other life conditions that they have all their life. Some of them are grappling with the income for a long time. Others have stresses related to maybe mental health challenges.
Oh, allergies.
Allergies. Like for me, I have very bad allergies, and you can feel some of them. So they are life conditions. So even diabetes, when they don't have a crisis, we are looking at it as a life condition. And we are encouraging the diabetes patients to by telling them that, look here, for most of your life, you can be okay. And for the time that you have the crisis, we can deal with it. And the information is getting better, and with that information, we shall get better and better quality of life.
I agree with that. So the last question, in what advice would you have to give to people who are non-diabetic but have friends or family that
have diabetes?
Yes, that have diabetes.
So what I would say there is two things. One, regarding the person who has diabetes, they should be part of the team that helps this person.
Yeah.
The social support mechanisms are very important in improving the quality of life for people with chronic conditions.
Yeah.
So the family members, the significant others, and the community that knows should be a source of encouragement. They should support the treatment. If this person is depressed and they stop taking treatment, they should encourage them. And if it reaches a certain level, they should refer.
Yeah.
Or they should seek care from somebody who can come and talk to them.
Yeah.
They should not just leave them.
Yeah.
2, they should be part of the supportive environment regarding diet and physical activity. And they should create that enabling environment. Then the second aspect for these people is that type 2 diabetes can occur. If you've not got type 1 diabetes, type 2 diabetes can occur. And its prevalence is much higher than type 1. So there's each one of us has a lifetime risk of getting type 2 diabetes. So they should they should be part of the lifestyle measures that even the people with diabetes are taking. They should not say the person with diabetes should be the one to diet.
Those are your problems.
They should use it as an opportunity to start also to diet.
To retrain themselves.
They should retrain themselves. They should understand the issues, the mechanisms of diet, and the mathematics of food. They should understand it. They should understand the physical activity. And one of the areas they should help is looking for context-based ways in which they can increase, let's say, the physical activity of both their diabetes patient and themselves. Like, for instance, cleaning the house. They should look for, if they are not cleaning the house, especially the men, they should find ways of participating in that so that they increase their physical activity.
They should.
And then the diet, they should help in planning the diet and that. So diabetes is not very far from them.
That's true. What I can interject there, though, is they'd say that a diet that is good for a diabetic is good for everyone else.
That is
people shouldn't think that you're just eating sick people's food. No. A diet that is fit for a diabetic is the best diet for anyone.
All. So recently I was part of a team that is developing the national I was part of a consultative meeting where we were developing national guidelines for diet and later national guidelines for physical activity. And when you look at the diets, they provide dietary recommendations by age. There's not much recommendation regarding differences in diet for people with diabetes and those without diabetes. The differences are related maybe to synchronizing the treatment with the food, the feeding. So things like that. So, like you rightly mentioned, it's the same thing. So they should use it as an opportunity to participate in improving their lifestyles. Not just say, this is their issue, and for me, I have my issues. That's actually true. Well, thank you so much. This has been very informative. I hope everyone has learned something, and we'll keep bringing you a few of these videos every now and again. But thank you so much, Dr. Roy. One thing I wanted to highlight, for people who can afford, people with the type 1 and type 2 diabetes who can afford. I know we don't yet have good access in this country, but there are new types of insulin
that's true.
that are even better than the existing insulins. We have insulins where you need 1 dose a day with a half-life of 25 hours. So you have 1 shot a day. So those who can afford, they should be also looking. These are some of the technologies that I was talking about, and indeed new drugs, new oral drugs.
Well, that's actually very important. Recently, I met someone who's actually on those new insulins that you mentioned. And I thought initially they were very expensive, like 120,000, but apparently they're about 54,000.
Yes.
So,
so with time they will
it,
even get lower when they are no longer when they become generic forms become
more
widely
available.
So that's an opportunity. Insulin pumps are coming. And research is continuing.
It is.
Yeah.
Well, hopefully the insulin pumps are coming. Recently I acquired one actually, but it apparently was supposed to be for a lady who passed on, unfortunately.
Yes.
So the family decided to sell it off. So I got it, but the materials that work with it are not yet widely available.
Yes.
So right now it's just there, doing nothing.
Yeah.
But if we do get that technology, a lot of people's lives are going to be changed. Amazing thing.
Yeah.
So hopefully we shall get those services very soon. And also for nutritional services, I know people here do not easily like to go and ask nutritionists what they should eat.
Yes.
But I've realized that while our mindset might be that it's just food, it's not that important, or it's not that technical, it actually is.
It's very, very important.
Food is very technical and it might not be easy for you to understand it. So do consult a nutritionist. And a lot of nutritionists are out there looking for patients, and patients are there looking for nutritionists. But when they come together, patients take it for granted that you'll just give me your advice and for free, you know. So nutritionists are also starting to think maybe let's first, until they are ready to pay for their services, let's first leave them. And so if you really want help from a nutritionist, you should actually reach out, because once you figure out food, almost 60% of your management with diabetes is solved. Yes. So it is very important to actually do that. And I guess on that note, we shall wish you a lovely, lovely day, evening, depending on where you are in the world watching us. And hopefully you'll join us again next time.